In our rapidly evolving world, success is defined by turning challenges into opportunities. With enough foresight and ingenuity, the complex problems of today can become the achievements of tomorrow. I'm Fred Thompson. From business and technology to healthcare and the environment, join me as we take a closer look inside the workings of the modern global economy. Welcome to Inside Business. I'm Fred Thompson, and I'm Inside Business. Nowhere is the value of technology greater than in the medical arena, where every advance has the potential to better or save human lives. Let's peer into the future with some cutting-edge developments in medical technology.
Healthcare reform initiatives mandate cost savings from increasing efficiency of medical information sharing and increasing productivity from medical providers. One innovative teleradiology company has accomplished both by leveraging advances in information technology and bypassing obstructions to efficient data sharing.
The radiology industry faces a variety of challenges: the shortage of radiologists, the reliance on hand-carried films and printed reports, the barriers to information sharing, and the high cost of improving technology in the climate of decreasing compensation. Teleradiology was pioneered by the Air Force to handle the manpower shortages at the time of Desert Storm. Teleradiology allowed radiologists like myself to remain stateside while covering the troops in Iraq and in a worldwide basis.
There is no standardized methodology for sharing health information between the proprietary software of facilities. Instead, facilities print and hand-carry X-ray films to other healthcare providers. Musculoskeletal Imaging Consultants, MSKIC, was designed to bypass these barriers to health information sharing using the best features of the Mayo Clinic and military systems.
eRed Practice Builder software receives proprietary information from a number of systems and compiles this into a single listing for the patient. Patient's doctor and any of the referring doctors can refer to this images and reports on a single listing.
Dr. Smith contributes to Concord Imaging's ability to provide a high level of service and our reputation through his expertise and his relationships with our orthopedic surgeons and spinal surgeons. This is Dr. Fogel's patient with recurrent pain following surgery for a disc herniation. I see some findings that may require additional imaging.
Yes, I think gadolinium enhancement would be useful. If you'll get the additional gadolinium images, I'll get the old study from the other center.
Prior to teleradiology, the patient would have to make 2 more trips to the imaging center and 1 to Dr. Fogel's office. The films would make 3 rounds to Dr. Smith and 1 to 2 to Dr. Fogel's office. This process may require 2 weeks rather than less than an hour in the teleradiology scenario.
Recently, I had a problem with anatomy in the operating room. I called Dr. Smith, and he was able to answer my question by remote consultation. Before teleradiology, I would have had to cancel that case and reschedule another day.
Teleradiology has revolutionized how we practice sports medicine. It allows us to see a patient, evaluate the patient, get an MRI, get results, and formulate a treatment plan all within an hour. We have patients that come from long distances, and it saves them from having to make an extra trip.
Dr. David Schmidt performs a physical exam and orders an MRI. The MRI images are transmitted to Dr. Smith, and he dictates a report using voice recognition, and a report is available to Dr. Schmidt online within 5 minutes. As the athlete returns to the exam room, Dr. Schmidt consults with Dr. Smith during an online consultation session.
MSKIC uses cutting-edge technology to bridge geographic and proprietary barriers to information sharing. We're able to help the surgeon prepare for their surgery and feel much more comfortable that they've been able to share this information with an experienced musculoskeletal radiologist. In part, we're able to do the best for our patients in helping their surgeons prepare for their treatment.